Hello and welcome back to the College of Natural Health Sciences Bermuda, the Induction Prep course, Functional Anatomy. This is week number 6, so we are more than halfway through this course already. How about that? Today we will be taking a look at Chapter 5, where we will look at the elbow, the forearm, the wrist, and the hand. The learning objectives for today's lecture are to identify the main structures of the elbow, the forearm, the wrist, and the hand, including the bones, joints, special structures, and deep superficial muscles. We will label and palpate the major surface landmarks of the elbow, forearm, wrist, and hand. We will identify and demonstrate all actions of the elbow, forearm, wrist, and hand, and the movements available. We will identify and demonstrate passive and resisted range of motion of the elbow, forearm, wrist, and hand. We're going to draw, label, and palpate the deep and superficial muscles of the elbow, forearm, wrist, and hand, and name their actions. Palpation should include the origin, insertion, muscle belly, and demonstration of shortening and lengthening of the muscle. We're going to describe the function of each of the muscles of the elbow, forearm, wrist, and hand. We're going to identify both the synergists and antagonists involved in each movement of the elbow, forearm, wrist, and hand, such as flexion and extension, etc. And we're going to identify the movements and muscles involved in coordinated activities of the elbow, forearm, wrist, and hand, such as in lifting, shooting, twisting, and grasping. Now let's take a look at the surface anatomy of the forearm, beginning with the anterior view. Beginning from the left, we see the superficial biceps brachii and the deeper brachialis muscles, which form the rounded bulk of the anterior upper arm. And just lower to that, we see the cubital fossa, followed by the brachioradialis. The palmaris longus lies between the flexor carpi ulnaris and the radialis. The flexor carpi radialis lies between the brachioradialis and the palmaris longus. And just lower we see the radial styloid process. Over to the right, we see what is referred to as the olecranon process, and that is the bony prominence that we feel when we touch our elbow. The medial epicondyle of the humerus provides a common attachment point for several wrist and finger flexor muscles. Lower, we see the flexor carpi ulnaris, which lies most medial and follows the shaft of the ulna. The flexor tendons connect large muscle bellies of the elbow and forearm to insertions on the hand and wrist. And on the hand itself, we see the pisiform, which is something that we can palpate. Continuing with our surface anatomy of the forearm from the posterior view, beginning from the superior left, we see the large olecranon process of the ulna, and it forms the pointy end of the elbow and serves as an attachment point for the triceps brachii muscle. The aconius is a small muscle close to the humeral ulnar joint. And just beneath, we see the extensor carpi ulnaris, which can be seen along the lateral edge of the ulna. Traveling down further to the left, we see the ulnar styloid process. Over to the right, from the superior end, we see the lateral epicondyle of the humerus, which provides a common attachment point for several wrist and finger extensor muscles. The belly of the brachioradialis muscle is just distal to the lateral epicondyle. The extensor carpi radialis longus and brevis are lateral to the brachioradialis. The extensor digitorum is lateral to the extensor carpi ulnaris. And just lower we see the radial styloid process. Now let's take a look at the surface anatomy of the hand from the anterior view. Beginning on the left-hand side, we see the hypothenar eminence. The hypothenar eminence is separated from the thenar eminence by the radial longitudinal crease. Both prominences are formed by several muscles. Over to the right, we see the digital creases which separate the segments of each finger. The digital and proximal palmar creases reveal where the fingers meet the hand. And just beneath we see the thenar eminence. The thenar eminence is a major muscular prominence found on the anterior surface or palmar aspect of the hand. And just beneath we see the distal wrist crease, which separates the wrist from the hand. Continuing with our surface anatomy of the hand from a posterior view and beginning from the leftmost superior, we see the interphalangeal joints that join the phalanges. The metacarpal phalangeal joints form the proximal knuckles. And then we see the extensor pollicis longus. The borders of a depression known as the anatomical snuff box are outlined by the tendons from the extensor pollicis longus and brevis and the abductor pollicis longus. Just further down, we see the parallel skin creases that mark the radiocarpal joint and the radial styloid process, which is visible as a slight bulge proximal to the radiocarpal joint. Over to the right, the back or dorsal aspect of the hand is less musculature than the palmar aspect. Fewer muscles are needed to open the hand than to close it and grasp. Several tendons are visible, including the tendons of extensor digitorum. The ulnar styloid process is a small bump at the head of the ulna. Now let's take a look at the skeletal structures of the forearm from an anterior view. Beginning on the left most superior, the first thing we see is the lateral apicondyle. The humeral condyles articulate with the radius and the ulna. We can clearly see the humeral radial joint. We can see the head of the radius or the radial head, and we see the radial tuberosity. In anatomical position, the radius is the lateral long bone of the forearm. When the forearm moves into pronation, the radius crosses the ulna. The distal radius articulates with the first row of the carpal bones to form the radiocarpal joint or wrist, which allows flexion, extension, and radial and ulnar deviation. Over to the right, we see the humerus, we see the medial apicondyle, we see the humeral ulnar joint, which is a hinge joint allowing for flexion and extension at the elbow. We also see the coracoid process. The proximal radial ulnar joint is formed by the round radial head and the tuberosity of the ulna. Together with the distal radial ulnar joint, it allows pronation and supination of the forearm. We also see the ulnar tuberosity. The ulna is the medial long bone of the forearm in anatomical position. We also see the distal radial ulnar joint and the 8 carpal bones, the 5 carpal bones, and the 14 phalanges. Now looking at the posterior view, beginning once again from the left-hand side most superiorly, we see the ulnar groove. The ulnar groove allows space for passage of the ulnar nerve. Over to the right, we see the olecranon fossa, which is centered between the medial and lateral epicondyles. The olecranon process is a prominence that helps grip the humerus at the humeral-ulnar joint. The styloid process of the radius is just proximal to the radial carpal joint. Now let's consider the skeletal structures of the hand from an anterior view. Beginning from the left most superiorly, we see the phalanges. Each finger has 3 phalanges that are joined by a proximal and distal interphalangeal joint. Interphalangeal joints are hinge joints that allow flexion and extension of the fingers. Just beneath, we see the carpal metacarpal joints. The carpal metacarpal joints are formed by the articulation between the distal carpal bones and the 5 metacarpals. Over to the right, we see that the fingers join the hand at the metacarpal phalangeal joints. Smooth articular cartilage covers the areas where the bones touch. The thumb has only a single interphalangeal joint. The saddle joint formed by the trapezium and the first metacarpal allows opposition or touching between the tips of the fingers and the thumb. And now let's look at the 8 bones, the 8 carpal bones, which is a network of gliding intercarpal joints. Together with the carpal metacarpal joints, they open and close the hand via gliding. The 8 carpal bones are, beginning from the left, the capitate, the hamate, the pisiform, the tricatrum, the trapezoid, the trapezium, the scaphoid, and the lunate. Now let's take a moment to locate the bony landmarks of the forearm, and we can use the lecture notes as well as the color atlas of anatomy to give us a clearer picture as to where they are. And these bony landmarks are the olecranon process, the olecranon fossa, the lateral epicondyle, the medial epicondyle, the radial head, the ulnar ridge, the ulnar styloid process, Lister's tubercle, the radial styloid process, the carpals, the scaphoid, the metacarpals, the carpals, the pisiform, the hamate, the hook of hamate, and the phalanges. Now let's consider the ligaments of the elbow region from the anterior view. Beginning from the superior left, we see the radial collateral ligament. A thin oblique cord connects the medial radius to the tuberosity of the ulna. We also can see the annular ligament. Over to the right-hand side, we see the multidirectional ulnar collateral ligament, which prevents the medial border of the humeral ulnar joint from separating. It also maintains the position of the olecranon fossa as the elbow flexes and extends. Just down further, we see the interosseous membrane. It is a continuous sheet that connects the radius and ulna and serves as a muscle attachment site, transferring forces between the bones of the arm. And now we have the posterior view of the elbow region. The parallel fibers of the annular ligament capture the radial head and maintain its position snug against the ulna as the forearm pronates and supinates. The fan-shaped radial collateral ligament connects the head of the radius to the humerus between the lateral epicondyle and the capitulum. It prevents the lateral border of the humeral ulnar joint from separating and holds the radial head up against the humerus as the elbow flexes and extends. The thick cross-fibered interosseous membrane prevents the shafts of the radius and the ulnar from pulling apart or bowing. This is especially important during weight bearing on the hands and arms. Now let's take a look at the ligaments of the hand and the wrist region from an anterior view, beginning from the left. The palmar ligaments, deep transverse metacarpal ligaments, and the palmar metacarpal ligaments prevent excessive movement between the fingers. The palmar ligaments stabilize the palm of the hand. And here we see the palmar carpal metacarpal ligaments, the palmar ulnar carpal ligament, and the palmar radial ulnar ligament. Over to the right, we see the collateral ligaments, which stabilize the lateral movements of the fingers. The joint capsule of the first metacarpal joint is also visible, as is the palmar radial carpal ligament. Now let's take a look at the lymph nodes, the nerves and blood vessels of the forearm and hand from an anterior view. Beginning from the left, we see the cephalic vein. The medial cubital vein connects the cephalic and basilic veins. Readily visible, it is often used for blood collection. The median nerve descends from the brachial plexus to innervate the forearm and hand. The radial nerve branches from the brachial plexus into the forearm and hand. Over to the right, we see the brachial artery, which carries blood into the arm and then branches near the elbow crease into the radial and ulnar arteries. We can also see the ulnar nerve. The cubital lymph nodes help filter lymph from the hand and forearm before it returns to the axillary region and circulation. The basilic vein returns blood from the hand and arm to the axillary region. We also can see the ulnar artery. The ulnar nerve originates in the brachial plexus and descends to innervate the forearm and hand. We also see the palmar and digital arteries and nerves. Continuing with our look at special structures of the elbow from a posterior view, we see the ulnar nerve. The ulnar nerve is superficial at the ulnar groove of the medial epicondyle of the humerus. Trauma to this region of the ulnar nerve, such as hitting the funny bone, causes painful or burning or tingling feelings. Over to the right, we see the recurrent interosseous artery, and it lies deep to the anconeus and extensor carpi ulnaris muscles. Now let's consider the bursae of the elbow from a posterior view. Beginning from the left most superior, we see the subcutaneous bursa of the medial epicondyle. The olecranon bursa is divided into 3 parts, each at a different depth. The subtendinous lies under the triceps brachii tendon. The intratendinous lies between the tendons. The subcutaneous lies between the skin and the tendon of the triceps brachii. This multi-layered approach reduces friction between the tendons and it protects the surface of the olecranon process. Over to the right, we see the subcutaneous bursa of the lateral epicondyle, followed by the bursa of the anconeus. Bursa at origin of the extensor carpi radialis is also present. Now let's take a look at the carpal tunnel. The carpal tunnel is a passageway through the proximal hand that contains the median nerve and the flexor tendons of the fingers and thumb. When the space in the carpal tunnel becomes limited, either by way of inflammation or enlarged tendons, for example, the median nerve can become impinged, causing symptoms such as pain and loss of function collectively. It is known as the carpal tunnel syndrome. So now we can take a look at the flexor tendons and the synovial sheaths of the hand from an anterior view. The flexor tendons include the flexor digitorum superficialis and profundus, the flexor pollicis longus, the flexor pollicis brevis, the abductor pollicis brevis, the flexor reticulaculum, and the flexor carpi radialis. The long flexor tendons of the fingers and hand are encased in synovial fluid-filled structures called synovial sheaths. These function much like bursae to lubricate the tendons, reducing friction as they move. Now let's consider the superficial muscles of the forearm and hand from an anterior view. Over to the left, most superiorly, we see the brachialis, followed by the brachioradialis. Then we see the extensor carpi radialis longus. Then we see the extensor carpi radialis brevis, the flexor pollicis longus, and the pronator quadratus. Over to the right, we see the biceps brachii, and again we see the brachialis. We can also see the pronator teres. We can see the bicipital aponeurosis. We can see the flexor carpi radialis, the palmaris longus, the flexor carpi ulnaris, the flexor digitorum superficialis, the flexor digitorum profundus, the flexor retinaculum, and the palmar aponeurosis. Now let's take a look at the superficial muscles of the forearm and hand from a posterior view. Beginning from the superior left, we see the medial head of the triceps brachii. Then we see the aconius muscle. We can also see the flexor carpi ulnaris. The extensor carpi ulnaris is also visible, as is the extensor digiti minimi. We can also see the extensor indicis. Over to the right, we see the triceps brachii, lateral head, the brachioradialis, the flexor carpi radialis longus, the flexor carpi radialis brevis, the extensor digitorum, the abductor pollicis longus, the extensor pollicis brevis, and the extensor pollicis longus. Now these are the deep muscles of the forearm and hand from an anterior view. From the left, we see the supinator. We see the flexor pollicis longus. Over to the right, we see the flexor digitorum profundus, the pronator quadratus, and the lumbricals. From the posterior view, the deep muscles of the forearm are, beginning from the right-hand side this time, the aconius and the supinator. We can also see the abductor pollicis longus. We can see the extensor pollicis brevis and the extensor pollicis longus. Over to the left, we see the extensor indicis. And these are the general techniques we use for palpating muscles. First, we locate the muscle's origin. Then, we locate where it inserts. Then, we locate the muscle belly. We activate the muscle by using resistance. We can shorten the muscle, and we can lengthen the muscle. Now let's consider the muscle attachments from the anterior view. Primarily, muscles of the elbow, forearm, wrist, and hand originate on the humerus and proximal portions of the radius and ulna. And we see it highlighted here in red. Most insert distally on the carpals, metacarpals, and phalanges. This is highlighted in blue. Muscles usually bring their more mobile distal insertions toward their more stable proximal origins as they shorten. And here we have a posterior view of the arm muscle attachments. Remember, the red highlights where the muscle originates from, and the blue highlights where it inserts. Now let's consider the movements that are available at the elbow joint. In illustration A, flexion is demonstrated. 140 degrees is considered to be full range of motion. In diagram B, extension is demonstrated. And we can see that the arm is fully extended, and therefore we have what is referred to as a zero end range. In diagram C, supination is being demonstrated. 85 to 90 degrees is considered to be full range of motion of supination. And in diagram D, we see pronation. Again, 85 to 90 degrees is considered to be full range of pronation. Now let's consider the movements available at the wrist. In illustration A, we see wrist flexion. Full range of motion with respect to flexion is considered to be between 80 to 90 degrees. In diagram B, we have wrist extension. Wrist extension is considered to be within normal range between 70 to 90 degrees. In diagram C, we have radial deviation. At about 15 degrees of radial deviation is considered to be within normal limits. And in diagram D, we see ulnar deviation. Anywhere from 30 to 45 degrees is considered to be normal range for ulnar deviation. Now let's consider the movements that are available at the fingers. In our consideration, we look at the metacarpal phalangeal, the proximal interphalangeal, and the distal interphalangeal joints. Flexion, extension, adduction, and abduction are all movements that are available at these joints. Now let's consider the movements that are available at the thumb. Diagram A illustrates flexion. Diagram B illustrates extension. Diagram C illustrates adduction. Diagram D, abduction. Diagram E, opposition. And diagram F, reposition. Now let's review the purpose of passive and resisted range of motion. Passive range of motion helps the therapist to establish the health and function of inert structures, such as the joint capsules and the ligaments. Resisted range of motion helps the therapist to establish the health and function of dynamic stabilizers and prime movers. They also help to identify balance and potential imbalance between muscles that bend and turn the arm and grasp and release objects. Now let's consider the passive motions of the elbow and forearm. Diagram A illustrates elbow flexion, B illustrates elbow extension, C illustrates forearm pronation, and D illustrates forearm supination. Let us now take a look at the passive motions of the wrist. Diagram A illustrates wrist flexion, B illustrates wrist extension, C illustrates radial deviation, and D illustrates ulnar deviation. Now let's look at the passive motions of the fingers and the thumb. Diagram A shows finger flexion, B shows finger extension, C shows thumb flexion, and D shows thumb extension, followed by E, thumb abduction. And now let's look at the resisted motions of the elbow and forearm. In diagram A, the therapist is performing resisted elbow flexion. Diagram B, resisted elbow extension. Diagram C, resisted forearm pronation. And diagram D, resisted forearm supination. And now let's look at the resisted motions of the wrist. In diagram A, we have resisted wrist flexion, B, resisted wrist extension, C, resisted radial deviation, D, resisted ulnar deviation. And here we have the resisted motions of the fingers. A, resisted flexion, B, resisted extension, C, resisted adduction, D, resisted abduction. And here we have the resisted motions of the thumb. In diagram E, we have resisted flexion, F, resisted extension, G, resisted adduction, H, resisted abduction, I, resisted opposition. Okay, so we're going to summarize the main points of today's lecture. The elbow is comprised of 3 bones, the humerus, radius, and ulna, and 2 joints, the humeral ulna and proximal radial ulna, which allow it to hinge. Flexion and extension and rotate, pronation, and supination are the movements possible at the joint. The wrist and the hand contain several bones and joints, including the radius, the ulna, the carpals, the metacarpals, and the phalanges. This complex architecture allows various movements in this region. Powerful muscles such as the brachialis and the brachioradialis create strength for lifting and carrying objects. Many muscles that control movement in the wrist and hand reside close to the elbow, including the flexors and extensors of the wrist and fingers. Specialized muscles like the pronator teres, pronator quadratus, and supinator pivot the forearm, helping to position the hand and perform twisting motions. The thumb is unique and has a separate muscle group to control its movements, including pressing, grasping, and releasing. Muscles of the elbow, forearm, wrist, and hand work in harmony to create movements such as lifting, twisting, shooting, and grasping. Okay, so we have reached the end of our lecture. Our assignment for this week, assignment number 5 for week 6. First, you're going to list the structures of the elbow and forearm, the wrist and the hand, including the bones, the joints, the special structures, and the deep and superficial muscles. You're going to list the major surface landmarks of the elbow, forearm, wrist, and hand. You're going to list the movements possible at the elbow, forearm, wrist, and hand. And you're going to describe the unique features of the thumb and the movements that are possible at the joint. Now, if you have any difficulty with this assignment, remember that my office hours are on Thursdays from 4 to 6 p.m. And you can shoot me an email if you need any additional support to get through this assignment. And don't forget to leave a comment at the bottom of this video, as well as in the discussion page for our YouTube channel. And I look forward to receiving your assignments and conversing with you in the forums. Do take care.